Oftentimes, breast cancer presents as a lump in the breast, but sometimes a person might actually have breast cancer and not feel a lump. If you notice any change in your nipple or the skin around the nipple, or any change on the skin of your breast in general, you need to be reporting that to your doctor. But in this video, I want to specifically talk about Paget's disease of the nipple, or we call Paget's disease of the breast, which are changes around the nipple and the skin around the nipple, just next to the nipple, that look like eczema. You know how skin eczema looks: dry, cracked, scaly, whitish flakes, scaly. When that happens, when that appears on your breast, on your nipple, and the skin around the nipple, you need to take that serious because it could be a sign of breast cancer. Some people might notice that when they itch or scratch that area, it bleeds. And over time, if left untreated, it might form a wound, an ulcer. When you report this to your doctor, what we'll normally do is we'll examine you, obviously with a chaperone, and then we'll refer you to a breast clinic where you have, further scans. You have a low dose X-ray, what we call a mammogram, to help diagnose. You might also have some other imaging, CT scans to check if it's spread. And then usually you have that area of the breast removed. Sometimes the entire breast might be removed, depending on the size and what we call the stage of that breast cancer. Because usually when we see Paget's disease, those eczema changes in the nipple, it's oftentimes breast cancer. So the treatment the person will receive depends on whether the cancer is still in the nipple, or whether it has spread to other parts of the breast, or whether it has spread beyond the breast. So surgery will usually be done, and then you might have radiotherapy, chemotherapy, and what we call biological therapies, depending on, again, the stage or how advanced that cancer is. So don't ignore any changes in your nipple, or any changes in your breast, or even changes in your armpits, the axilla. I hope this video has been helpful. Do share it because it could save lives.